Democrats have a pretty basic message when it comes to the health care bill, whether you look at the House or current Senate vision, and it is a danger to you. Question is, what can the Democrats do to stop it? Let's discuss with Democratic Senator Tammy Baldwin of Wisconsin. Senator, a pleasure.
It's a pleasure to join you.
What is the response? You're out there, you're messaging, but at the end of the day, if it comes down to numbers, are the Democrats relegated to sitting and watching?
Well, first of all, healthcare is deeply personal. For me, I was a child who had a very serious illness and then was labeled as a kid with a pre-existing condition. My grandparents who raised me couldn't find insurance at any price for a large part of my youth. And I know my story is replicated by thousands upon thousands of Wisconsinites, millions upon millions of Americans. It is deeply personal, and part of what we have been doing in exposing what the House passed and now what was revealed in the Senate is engaging the voice of the American people, because that's really the only thing. You know, what can Democrats do when we're in the minority in the House, the minority in the Senate, we don't have the presidency? It is engage the American people in speaking out about this. And boy, we could our colleagues are hearing.
On the Republican side?
Well, on both sides, but
right.
Certainly what's key right now, since they've used these extraordinary procedures so that they only have to pass it with 51 votes in the Senate rather than the usual 60 votes, that's what's so critical. We've had a number of Republican senators expressing serious misgivings over the weekend. I applaud them. We've not only got to take on this fight with everything we have, we've got to win.
You think you can forestall a vote, or do you think there's going to be a vote before the recess?
You know, I don't know what Mitch McConnell's plans are going to be. Delay doesn't make this bill any better. It's still, we'll hear from the CBO, the difference between the House and the Senate, but House bill predicts 23 million Americans will lose their health insurance in the next decade. And then the Medicaid cuts, which are worse in the Senate bill than they are in the House in their cumulative effect. It impacts rural health. It impacts people who have loved ones in nursing homes. And then the weakening of protections for people with pre-existing conditions is devastating to, you know, a huge swath of the American people.
So respond to what we're hearing from the other side, because you have the Health and Human Services Secretary, Tom Price, who says premiums aren't going to go down on the whole, and no one's going to lose coverage. And then Kellyanne Conway said this.
These are not cuts to Medicaid, George. This slows the rate for the future, and it allows governors more flexibility with Medicaid dollars because they're closest to the people in need. If you are currently in Medicaid, if you became a Medicaid recipient through the Obamacare expansion, you are grandfathered in. We're talking about in the future.
Are you grandfathered in? Is this just reducing the rate of growth in Medicaid?
You know, it's about affordability, and if they change the formula, as they're proposing to do in the Senate bill, and you can't keep up, then it means insurance and health care is unaffordable to you. Our goal ought to be, on a bipartisan basis, to make health insurance more affordable to more Americans. What the Senate bill and the House passed bill does is go exactly in the opposite direction, and, as some of your previous guests have noted, transfers resources from low and middle income people who are being helped pay for their premiums to the ultra-rich who are getting tax breaks of enormous proportions.
Now, listen, I understand the arguments that the Democrats are making, but I do have a question. Maybe it's a tactical question more than a substantive question. But you know that the main driver here, no matter what we're hearing in terms of policy, is the Republicans promised a repeal of the ACA. And everybody knows that the ACA has a lot of individual marketplace issues that need to be addressed. Some are because states didn't accept the expansion. There are a lot of different reasons. But you have problems, okay? They're going to repeal it if there's any way that they can. That's the promise that they have to make good on. I don't hear the Democrats approaching that reality, that let's see if we can somehow negotiate something that's going to happen. They're going to repeal. They have the votes. It's just a question of what it takes for them to get there. It might not happen, but there's a very good chance. I don't hear Democrats engaging on that level of trying to negotiate some type of fix to help the Republicans get what they want?
You know, on the contrary, I talk about this all the time. What we need to do is fix the Affordable Care Act, not scrap the Affordable Care Act. And they would have willing partners the day that they stop the partisan nonsense of trying to repeal something nicknamed after the former president and started working to advance affordable health care for the American people.
Couldn't you repeal the current pricing models in some of the individual markets and some of the certain conditions that the providers have to meet, repeal them, and then replace them with something that works better that's negotiated? Isn't that something that could make both sides happy?
Yeah. So two things. One is the disruptions right now in the marketplace that are being reported are really of Trump's making. His threatening to withhold the cost-sharing responsibility payments is enormously disruptive. And frankly, what could be more disruptive than saying we're going to repeal the whole health care law? That said, keeping costs down is something we can work together on. One of the big burdens that many deal with right now is the high cost of prescription drugs. I've teamed up with John McCain to introduce a measure that would add accountability and transparency to this market so we can rein in these prices. There are other price and competition issues that we can absolutely deal with together on a bipartisan basis, but they have got to renounce this partisan nonsense to repeal, and let's work to fix what's wrong.
That's a big but, though, given the current climate and the weight of that promise to repeal. Senator, thank you very much. Tammy Baldwin, always good to